thank you for hearing us. I'm Ester DeJong, also University of Florida, next door to her. I want to talk about, not surprisingly, with these weaknesses that Dr. Harper has just brought up. It raises questions about the rule changes. And I want to say that I'm not standing here just by myself. I'm kind of repeating points that particularly FABUS, the Florida Association for Bilingual and ESOL Supervisors, who an association that represents all of the supervisors here in the state, has made repeatedly. And so I want to kind of reiterate some of those points, particularly as it relates to intake and exit. I think the discussion about progress is a little bit differently. We know that there's some sense of expediency on this particular issue, but I want to caution the board in this case to keep that eye on the prize and do the right thing as well for the almost more than 250,000 ELLs that we have in the state. So let's think a little bit about why intake would maybe not be an appropriate purpose for SELA at this point in time. We're not saying that it would never be, but at this point in time, given how it's structured and the qualities that it currently has or not has. The first piece is that clustering that Dr. Harper just talked about, that we have kindergarten, first and second graders as one cluster. Well, for intake purposes, that means that eligibility for a kindergartner means that you have to bar extraordinarily high, because that's kind of aimed as a second grader. Whereas eligibility for a second grader is kind of lower than it really ought to be, because you're kind of trying to meet the two kind of in the middle. And so there's a danger of really under-identifying those students who need the services the most, i.e. the more older students. And this will happen in each one of the clusters. So the use of the clusters, as opposed to having scores available for every grade, is a concern for intake purposes. As Dr. Harper pointed out, there are some questions around reliability and validity. And if we were to be using the SELA for intake, that means that we're potentially using that kind of a test to make decisions about whether students are going to receive the kind of services that they need in order to have equal access to the curriculum. And I think the DOE itself has pretty strong language about not approving any assessments that are not valid and reliable in terms of these kinds of assessments. I think that's the language in the rules itself. Thirdly, in terms of the intake, as Dr. Harper said, there needs to be a lot more professional development, if not a separate form development, in order to avoid the issue of you repeat the form, you repeat the form, you repeat the form. Imagine having that form being used also now for intake. So I use it for intake maybe in the fall semester when I come in, and I take it again in the spring semester, and I may take the same form again the next year or the year after. There certainly is a memorization aspect that's going to happen, familiarity, and so we're no longer really assessing the actual proficiency of the students. We're just testing, do you know the test by now? So that's for intake. So that's some concerns about allowing the test to be used for intake, and that is on your rule, particularly for C. I would encourage you not to approve that section of the rule change in the first piece of 6A 60902. For 6A903, the focus is on exit. In other words, how do we determine that students are ready to no longer receive services? In this case, the SELA is proposed as one of the measurements or indicators, but there's two kind of concerns that I have with that one. The first one is that the proposal is that composite scores are being used as opposed to individual scores for each of the subtests. There's 3 subtests: oral skills, listening and speaking, reading and writing. The idea is to use a composite score to say, okay, now this is one indicator that you're ready to be exited from ESOL services. Now, we're not quite sure what the formula is for the composite scores. I don't think that has been given out. It's there. And so that would be one question, how has it been determined? But having a composite score means that if a student has variability on any one of the subtests, you kind of group it all together. You hide that variability. And a typical pattern for a second language learner is that you initially may score quite high on the oral skills test, but then you may be quite low on the writing test, and maybe proficient on the reading test, and yet you come out proficient. Well, at a 5th grade level, I wouldn't want my ELLs to be exiting the program if they still are low intermediate writing scores. They have to be able to write at a proficient level. So if the CELA is to be used for exit purposes as well, the score should really be at a proficient level across the subtests and not a composite score. Also, if you look at the other indicators in the rules, for each one of those, the criteria is be proficient for that particular test in listening, speaking, reading, and writing. So why not at least then have the same rule for the CELA? There's no reason to do something different for the CELA if it were to be used. The issue of cut scores has already been raised. I think that's a real issue. Until we kind of know a lot more about how these cut scores relate to FCAT performance, I would hesitate. Again, this is such an important decision that we're making for this group of students that we don't want to tell them you're no longer need or you're no longer entitled to services if really they still are. And I think, again, I caution on this one to err on the side of prudence and having more information. So just to kind of summarize that, for intake and exit, the CELA is probably not ready yet to be used. And I would encourage you to not approve those sections of the revised rules. For progress, which is a mandate, we do need to do that as part of the federal mandate. It seems that the CELA is a little bit further along in being able to do that. We do still need more information. We also need particular information at each of the grade levels rather than the clusters, but that's probably already available. It's just not being reported. This is not unprecedented. Michigan and Illinois both only use their language assessment test for what are called the AMAO purposes, so Florida certainly wouldn't be standing by itself. The other issues that we have to report on, as in the number of ELLs, how many are proficient, how many are being reclassified, that data is reported on an annual basis. There's an alternative that Florida has that could be used in the interim that we do more work on the CELA. So I don't think we're stuck in terms of not meeting federal guidelines on that. So I think that as Dr. Harper said, more research is needed. We tend to say that as researchers, but in this case, I think it has real implications. If we were to be using the CELA at this point for intake and exit, I would encourage the board to not approve those sections and maybe put together a way of improving the information that we do need in order to approve that usage and the purpose of the CELA at this point.